Good afternoon, and thank you for joining us today. My name is Maria Oquendo, Coordinator of Hispanocare, a program of Advocate Illinois Masonic Medical Center. And today we are going to be discussing MRI scans and what you need to know. Our lines are open today for calls, and the phone number is located at the bottom of your screen, 312-738-1060. This is a live interactive call-in show, so for those interested in learning more about MRI services, please feel free to give us a call today. Joining us today for this wonderful discussion is Kurt Pruess. Thank you so much, Marketing Director for MRI Services of Chicago.
Thank you, Maria. It's a pleasure to be here. Thank you.
Thank you. Now, I know there's a lot of kind of confusion as to what MRIs really are. What does it stand for? What does MRI mean? So I think that's a great thing that we can start off with right now.
MRI, Maria, stands for Magnetic Resonance Imaging, and uses magnetic waves and radio waves to obtain information to get the images into the computer so the doctor can read it. So MRI means Magnetic Resonance Imaging.
Okay, great. And how does that work exactly?
MRI is really easy. MRI, what happens, I'm sure most of you have had an MRI or know someone that has had an MRI. It uses a magnetic field, and what happens in the atoms in your body, the magnet rotates the atoms in your body at a very high speed, and so what happens with that, they create a radio wave. So if you've ever had an MRI or know somebody that has, they are wearing what's called a coil, which goes either around your knee or around your neck or on your brain. And so as these atoms are spinning, they are releasing a radio frequency, and this radio frequency is picked up by the coil, which then transfers that information to the computer. So that's what allows you to see the image of your body, whether it be your brain or your knee or your shoulder. So that's basically in a layman's terms on how an MRI works.
Great. Now we know how it works. Why would it be done?
MRI has been around since 1984, and for physicians it's the gold standard in finding parts of the body which they feel are not obviously working properly for you, and it's ideal for soft tissue. And what we mean by soft tissue, muscles, tendons, vertebrae, anything but bone. Even though it can look at bone, but it's not designed for looking at that type of information. So your knee, your shoulder, your brain, your spine. That's why a doctor orders an MRI, because it gives them several amounts of information. And the interesting thing is that it looks at it in three different type of planes. So it's not just one type of plane, and I don't mean a plane like in the air. It's a plane that we look like in geometry, where you'll see it cuts this way, and then this way. So the doctor can see it in three different views, that particular body part that they want to examine more to see what is the problem going on with their particular patient.
Nice. So three different angles that you're able to see the exact same thing.
That's correct. It looks at three different planes, and it's called coronal, axial, and sagittal views. Okay. So we're going through the layman's terms of everything you always want to know about MRI, but we're afraid to ask.
They're going to be experts by the time this show is
done. That's
right. Now, talking about the brain and the shoulder, so when getting an MRI, is it a full body that always has to be done, or can it be segmented?
When you have an MRI, it's done by a body part. So let's say that you're having headaches, for example, and you don't know why. The doctor says, Maria, we're going to order an MRI for you. And so you go to the MRI place, and they put what's called a brain coil, a coil that goes over your head. And what happens then, through the computer, it slices up the brain electronically to look at your brain in three different views. So when we talked earlier about the three different angles, the axial, sagittal, and coronal. So, for example, when we look at an axial view, it's slicing this way, so you're looking down.
Okay.
And so the other one is coronal, where it takes slices of your brain and going from front to back. So it slices it this way. And then the other way is the sagittal view, where it's looking at the side. So it's slicing it from left to, so you have left to right, front to back, top to bottom.
Wow, that's a lot of different views
Right.
looking at just
and so
one
what
thing.
happens is at the MRI it's done in slices. So you'll see slices 1 millimeter, 2 millimeters, 3 millimeters, and so forth. So the doctor can get, or the radiologist who's reading it, gets very good information to provide for the doctor, the patient's doctor, to see all what is transpiring in Maria's brain.
Wow, that's okay. Before my comment, I believe we have a caller on the line.
Good evening.
Good evening. Go ahead with your
I
question.
wanted to ask your guest, I had the first MRI I've ever had in my life done on my right shoulder not too long ago, and it revealed what they call a snap tear from, the anterior, the posterior, however they worded it, a complete snap tear of the rotator cuff. And I had that MRI done without an injection I guess that's for contrast.
Mm-hmm.
Would it have been more revealing, a complete for the doctor who reviewed the MRI? Would it have been a better choice to have that injection done to get a more, a better view? I guess that's what I'm trying to find out.
Thank you so much.
By getting an injection, yeah.
Right. Okay. So we'll go ahead and answer that question.
Well, I don't play a doctor in real life, but I do play one on TV. To answer your question, your doctor ordered it specifically. Did he say without contrast? I think
he had it without contrast.
Without,
so we wanted to know would there have been a difference?
Well, in his, I would have. It depends. I wish I had a better answer for you, sir, but I don't. It depends on the type of injury that you had in your shoulder. Doctors do order contrast, or otherwise known as gadolinium, to look at areas more specifically for more information. That's when they would, as you alluded to, as having the contrast injection. I don't know. In your particular case, they probably felt that it wasn't necessary. But if you felt, or as you learn more about MRI, maybe it's a good question to ask your doctor to get more information. So I can't answer your question definitively, but yes, in some cases, gadolinium or contrast material can give you more information. Yes.
Okay. Well, that was a great question. So hopefully, we will get a few more in today, and which leads us into the next question: what is contrast?
Sure. Contrast is a medium, is a material that is used, that doctors or technologists use to inject at a certain body part to get more information. When you do an MRI, if anybody's ever seen an MRI, it's a lot of grays and whites and blacks, and it has a lot, and it provides specific information primarily to the radiologist, to the diagnostic reading radiologist. And so what happens, the gadolinium, which is typically injected through the vein, goes into the body, goes into that specific body part that you're looking at, and gives more detail to the radiologist to look at that particular body part, and giving them more information. Under certain conditions, under certain diagnoses, a doctor would order many of you may have seen it as an MRI with and without. What that means that an MRI is being done without the contrast, and an MRI is being done with the contrast. So when you see an order from your doctor and he says MRI with and without, well, you know that you're having the contrast injected, or the gadolinium injected into your body, and that's harmless for you as well. You don't have to worry about that being harmful in any way to you. Like an MRI is not harmful to you.
Okay, so that would be then leading into our next question.
Okay.
is there any pain involved in getting an MRI? You talked about scanning my brain and chopping it up into little pieces. That seemed a little scary, a little painful.
Well, no, an MRI is not painful. The hardest part that most patients have with an MRI, Maria, is laying still. Okay, as we talked earlier, if you remember how an MRI works, is that the atoms are rotating very fast and giving off a radio signal. And so if you start moving, let's say how we talked earlier about you having a brain scan.
Right.
Okay, you have a coil that goes over your head and you're having a brain scan and you start moving your head, that interrupts the flow of information to the computer.
Okay.
And so we don't want that. So where you find more often is not so much is the exam painful, but it's sometimes uncomfortable for the patient, Maria,
because you have to stay still.
You have to stay still.
You have to be very still.
And
okay.
so what happens is that depending on the type of scan, whether it's with or without contrast, a scan could go anywhere from 15 minutes to an hour, depending on the type of scan that your doctor ordered. So yeah, if you're in a lot of pain, we always recommend taking some Xanax or something to help relieve the anxiety for you, so you can stay still. Because you don't want to be uncomfortable, and because what happens is many times is that your technologist will have to pull you out and say, Maria, are you okay? And I'm just real uncomfortable. Then we have to reposition you, put you back into the machine.
Right.
And so it's just being aware whether can you sit still for an extended period of time.
Okay. All right. Well, that is definitely good to know, and my brain is reassured that it's not going to be caused any injury with the cone or the slicing.
No, you're not going to have any injury. It's painless. The other thing that patients will talk about is the sound that the magnet makes.
Okay.
A lot of patients will say, "Oh my, I really dislike that knocking sound that I hear."
Okay.
And so, and there's nothing that you can do with that because it's the design of the magnet.
Okay.
However, some magnets have it, and some magnets don't. Typically, your open MRI magnets don't have that knocking noise.
Okay.
And so for some patients, an open MRI is a little bit more convenient, and I guess that probably leads into our next question. Right?
Yes, definitely.
So Maria was going to ask me, Kurt, what's the difference between a regular magnet and an open MRI magnet? If most of you are aware or had an MRI or know someone that's had an MRI, they probably complained about, boy, I had to go into this long tube, they slid me in there, and I heard this knocking noise for a half hour, drove me crazy. Well, what happens with there's a magnet, and many of you probably have heard of it, is what's called an open MRI. An open MRI is the design of a magnet. So if we remember, MRI is a tube. So you go into the tube and you lay there still, and as you would with an open, but an open has a specific design mainly for patients who are either claustrophobic, can't go into the tube, and it's like, I'm going to go crazy, or B, they're physically large and cannot physically fit into the tube. So the design of the open MRI was created to manage that particular patient population.
Okay, so it seems a little more comfortable.
A little bit
You're
more
not
comfortable.
encased in something.
Right. A lot of it's
Okay.
interesting. In the many years that I've been in this, we find the people that are most claustrophobic are police officers.
Really?
Police officers, we find, are the most claustrophobic and most want to have be in an MRI type of setting, open
Wow.
MRI setting.
Okay. Well, let me just take this quick opportunity for those of you who are just joining in. My name is Maria Oquendo. I am the coordinator for Hispanocare, which is a program of Advocate Illinois Masonic Medical Center. And soon we will be thanking yet another person from MRI Services of Chicago, and that is Alicia Gionta, who is the vice president for the company. And she will be in for the remainder of the show answering some of the rest of the questions. Thank you, Kurt, so much for joining us. And we wanted to show the viewers actually what the MRI the machine actually looks like. And that is right here. As you can see, the machine, and there is an open plateau right here where the person would be sitting and lying down. And we'll have that up. Now, back to the show. Thank you, Alicia, for joining us.
Thank you for having me.
Yes, it was a pleasure talking with Kurt for those almost 15 minutes. And time definitely goes by fast. We're only here for 25 minutes, and there's so much information to kind of go through. Now, we talked about, is it painful? Because he tried to slice my brain, and I wasn't very, very fond of that, but that's okay. We talked about the differences between open and the conventional MRI.
Right.
Now, for an MRI, does a physician always need to refer that? Is a referral needed? How is that covered?
An authorization, a prescription is always issued by the physician. It is required for any type of MRI exam. So that usually comes from the primary care physician or any specialist that the patient may have seen.
Okay, great. Now, talking previously about staying still, are children able to get MRIs?
Children are. It's very difficult for children to lay still for the amount of time required for an MRI. Most diagnostic centers, larger ones, have where the child might need to be sedated. However, it depends on the age of the child and the examination that's actually being performed.
Is there a certain age range for children? Like you wouldn't recommend it for children under the age of, let's say, 6 or 5 or
Usually,
3 months old?
I do believe it's under the age of 5. I'm not exactly 100% sure on the age. Our particular center does not specialize in pediatrics.
Okay.
So I'm not exactly sure on the exact age.
Okay, great. Well, I believe we have another caller.
Yes, good evening, ladies. How you doing? I came in and I heard the young gentleman that was speaking and talking about certain people, and especially those crazy men that get a little fearful of the MRI. Well, let me tell you, I finally had it done. I had the open face done. I don't want to name the company, but it was on far north. And had a little mild sedative. Hell, I couldn't even get into the car going to the place. But listen, to make a long story short, it was a wonderful experience. They even let me listen to some jazz while I was in there. They put some music on, and it was a wonderful experience. But sometimes us men, we are the most craziest creature on God's green earth. It's just that fear factor to be enclosed and make you feel like you helpless, vulnerable to things. And I think it's more of a mindset. But again, for all men who's two things men don't like to do. We don't want to visit the radiology for MRI, and we definitely don't want to visit the urologist. But let me tell you something. The MRI was good. The ideal is to find the right person and the right place to go and have it done. Let me get out the air so I can hear your response, and thank you for taking the call.
Thank you. Thank you, caller, for calling in. That is wonderful to hear that someone had a very, very nice experience, especially being so apprehensive to begin with. And it really is finding a location, finding people who can calm you.
Yes.
A lot of times it's not necessarily what you take, but it's the people surrounding you.
Exactly. And that is, most patients do come in and they are very nervous and very apprehensive about the exam. Sometimes patients do require some form of sedation of some sort, but the music does help. Having that mindset, having the right technologist performing the exam, helping it being, giving the patient care and making them more at ease is very, very important. So, and it's not just men. I personally myself have had issues in being nervous, having an MRI, yourself, and it's a scary, to go through, but it's very beneficial in the end to get their findings and hope that they're positive. So.
That's great. Well, which is why we are doing today's show, which is so important, is to hopefully try to alleviate some of the fears that our audience may have when it comes to getting an MRI. And what are the different types of services that are being offered? What's the difference between an open and conventional? And as the previous gentleman just stated, being claustrophobic, being in in an enclosed environment, which is why open MRI is a wonderful solution to those that may have issues being enclosed. And I think that's great. Now, if we can move on really quickly, I know we're running out of time, but we've talked about children. We talked about not the MRI services not hurting, which is great. What about those that are pregnant?
Yes and no. MRI is considered safe. However, conclusive evidence on how safe MRI is for pregnant women and fetus is not completely available. If it is absolutely required for a pregnant woman to have an MRI, it's something that her physician should consult with the radiologist first, depending on the particular area that needs to be examined.
Okay, that's great. We talked about not moving during the MRI scan, which is very important, making sure that you stay still. And we wanted to just kind of quickly talk about also, is there any type of radiation, anything that we need to be aware of?
No, there's no radiation. MRI is completely safe. Like Kurt had talked about with the magnet, the radio waves, it's a completely safe exam. Again, not painful at all. For each patient, depending on their particular examination, what they're coming in for. Most patients are coming in that are in pain, either whether it's their shoulder, their knee. Laying still is generally the issue for most of the patients as far as pain. It's that because of the sequence of the sequences, there's generally 5 to 6 different sequences that can last anywhere from 5 to 10 minutes. There is that time in between where that you don't hear the knocking noise, which is the gradient coils, that the patient can move for, a few seconds. And, the technologist does communicate with the patient in between the exam the whole time. But it's during that time of the knocking noise that they do need to be completely still. And that does generally, that's generally the only, depending on the examination as far as pain is concerned.
Great. We had another question brought in from a caller. The doctor was told this particular patient that they should get an MRI for a possible torn meniscus. How long would that particular type of procedure last?
Normally, that would be an MRI of the knee. And generally, an MRI of the knee does take about 40 to 45 minutes. Again, the different sequences of the muscles in the knee, so generally 40 to 45 minutes.
Okay, great. Now, with it being magnetic, for those that have fillings, is there any effect to people who have fillings?
No, there's no effect with the fillings. Generally the only issue with fillings is if the MRI is of the head or the brain, that it may distort the images a bit for the radiologist, but it doesn't affect anything with the patient as far as the fillings in the mouth.
Okay, so if, let's say for example, I had a mouthful of fillings and you said it slightly distorts the image, would the radiologist still be able to?
The radiologist would still be able to read the exam. There may be some shadowing, a distortion of the images that the technologist would normally make a note to the radiologist, letting them know that there was fillings found, or how, and that would obviously be something that the radiologist would be able to see.
Okay.
But some of the shadowing just be distorted, but it wouldn't interfere. It should not interfere with the exam.
Right. Okay, perfect. Now, again, 25 minutes has gone by really, really fast. We had some wonderful questions, and for those that may have some additional questions, where can they call? What number?
Open MRI of Chicago is located at 3855 North Cicero in Chicago, and our phone number is 773-777-2888.
Great. Can you repeat the phone number again for our
773-777-2888.
Wonderful. Thank you so much, Alicia.
And thank you for having
to
us.
Kurt for coming out and giving us a lot of wonderful information. I'm sure our audience, with our wonderful phone calls and questions that have come in, hopefully we've been able to alleviate some of the concerns that are out there. Let them know that it is not painful. It is definitely beneficial to please go ahead, if you are prescribed an MRI, to please go ahead and do so. So on behalf of my colleagues at Hispanocare, Advocate Illinois Masonic Medical Center, and MRI Services of Chicago with Kurt and Alicia, we want to thank you for joining us today, and we hope to see you again next time. Thank you so much.